Question 1. Operational review demonstrates that a certified veterinary technician is tasked with interpreting a clinical chemistry panel for a canine patient diagnosed with chronic kidney disease. The panel reveals elevated blood urea nitrogen (BUN) and creatinine levels, which are consistent with the known condition. However, the panel also shows a mild elevation in alkaline phosphatase (ALP) and a slight decrease in albumin, which are not typically the primary indicators of chronic kidney disease in this patient's history. Considering the technician's scope of practice and the need for accurate reporting to the veterinarian, which of the following interpretations and actions best reflects professional responsibility? Option A. Focus only on the BUN and creatinine values, as these are the most direct indicators of kidney function, and consider the ALP and albumin values to be outside the scope of the technician's interpretation for this case. Option B. Report the elevated BUN and creatinine as expected for chronic kidney disease, and note the mild ALP elevation and slight albumin decrease as potential secondary findings requiring veterinary investigation, without offering a definitive diagnosis. Option C. Conclude that the elevated BUN and creatinine are solely due to the chronic kidney disease, and disregard the mild ALP elevation and slight albumin decrease as insignificant variations. Option D. Interpret the elevated BUN, creatinine, mild ALP elevation, and slight albumin decrease as definitive evidence of concurrent liver disease, and recommend specific liver support medications to the veterinarian. The correct answer is B. Report the elevated BUN and creatinine as expected for chronic kidney disease, and note the mild ALP elevation and slight albumin decrease as potential secondary findings requiring veterinary investigation, without offering a definitive diagnosis. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a technician must interpret clinical chemistry results for a patient with a history of a specific condition. The challenge lies in distinguishing between expected changes due to the chronic condition and potential new or worsening pathology. Accurate interpretation is crucial for guiding further diagnostics and treatment, directly impacting patient welfare and the veterinarian's diagnostic process. The technician's role is to provide accurate, relevant data and initial interpretations to support the veterinarian's decision-making, not to make definitive diagnoses. Correct approach analysis. The correct approach involves recognizing that while the patient's chronic condition may influence certain parameters, the technician's primary responsibility is to identify any values that fall outside the established reference ranges for the specific laboratory and species. Furthermore, the technician should note any significant deviations from the patient's previous baseline values, if available. This approach aligns with the ethical and professional standards for certified veterinary technicians, which emphasize accurate data collection, preliminary interpretation within their scope of practice, and clear communication of findings to the veterinarian. This ensures that the veterinarian has the most complete and accurate information to make informed diagnostic and therapeutic decisions, adhering to the principle of providing competent care. Incorrect approach is analysis. One incorrect approach would be to solely attribute all elevated values to the known chronic condition without considering other possibilities. This fails to uphold the technician's duty to observe and report potential changes in patient status. It could lead to delayed diagnosis of new or concurrent diseases, violating the ethical obligation to act in the best interest of the animal. This approach also oversteps the technician's role by making a presumptive diagnosis based on history alone, rather than objective laboratory findings. Another incorrect approach would be to ignore any values that are within the broad reference range, even if they represent a significant change from the patient's historical data. This overlooks the importance of serial monitoring and individual patient baselines, which can be critical for early detection of subtle but important changes. Failing to report such deviations could lead to missed opportunities for early intervention, potentially compromising patient outcomes and falling short of the standard of care expected from a certified veterinary technician. A third incorrect approach would be to provide a definitive diagnosis or treatment recommendation based on the chemistry panel. This directly exceeds the scope of practice for a certified veterinary technician, which is to assist the veterinarian. Making diagnostic or therapeutic decisions without direct veterinary supervision is a regulatory and ethical violation, potentially leading to patient harm and professional disciplinary action. Professional reasoning. Certified veterinary technicians must employ a systematic approach to clinical chemistry interpretation. This involves 1. Verifying the accuracy of the results against laboratory reference ranges and species-specific norms. 2. Comparing current results to previous patient data, if available, to identify trends or significant deviations. 3. Recognizing common patterns of abnormalities associated with specific diseases or organ systems. And 4. Communicating all findings, including any preliminary interpretations or concerns, clearly and concisely to the supervising veterinarian. This process ensures that the technician provides valuable support to the veterinary team while operating within their defined scope of practice and adhering to ethical and regulatory requirements. Question 2. To address the challenge of ensuring accurate and safe medication administration, a certified veterinary technician receives a prescription for a new patient. The veterinarian verbally instructs the technician to administer a specific medication at a certain dose and frequency. What is the most appropriate immediate next step for the technician to ensure adherence to basic principles of pharmacology and regulatory compliance? Option A. Ask a colleague if they have administered this medication to a similar patient before and follow their advice. Option B. Obtain a written or electronically verified prescription from the veterinarian before preparing or administering the medication. Option C. Proceed with administering the medication based on the verbal instructions, assuming the veterinarian is experienced. Option D. Administer the medication as instructed, but make a note in the patient's record that the prescription was verbal. Correct answer is B. Obtain a written or electronically verified prescription from the veterinarian before preparing or administering the medication. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a veterinary technician must administer medication based on a veterinarian's prescription. The challenge lies in ensuring the correct medication, dosage, route, and frequency are administered, as errors can have serious consequences for the animal's health and welfare, and can also lead to legal repercussions for the practice and the technician. The technician's role is critical in bridging the gap between the veterinarian's order and the actual patient care, requiring meticulous attention to detail and a thorough understanding of pharmacological principles. Correct approach analysis. The correct approach involves the technician carefully reviewing the veterinarian's written or electronically transmitted prescription. This includes verifying the patient's identity, the drug name, the strength of the drug, the exact dosage calculation, if applicable, though this question avoids math, the route of administration, e.g., oral, injectable, topical, and the frequency and duration of administration. The technician should then confirm their understanding of the prescription with the veterinarian if any aspect is unclear or seems unusual for the patient's condition. This adherence to the prescription and seeking clarification when needed is paramount for patient safety and aligns with the ethical and legal responsibilities of a veterinary technician to provide competent care and to act within the scope of their practice. This practice directly supports the veterinarian's treatment plan and minimizes the risk of adverse drug events or treatment failure. Incorrect approaches analysis. Administering medication based solely on a verbal instruction without a written or electronically verified order is a significant regulatory and ethical failure. This bypasses essential documentation requirements, increases the risk of misinterpretation, and can lead to medication errors. It also fails to establish a clear, auditable record of the prescription, which is crucial for legal and professional accountability. Assuming a previous prescription for the same condition is still valid without re-verification is also a failure. Animal physiology and disease progression can change, and drug efficacy or safety profiles might be altered. Relying on outdated information can lead to under- or overdosing, or the administration of an inappropriate drug, all of which compromise patient welfare and violate the duty of care. Administering medication without confirming the patient's identity against the prescription is a critical error. This could result in the wrong animal receiving the medication, leading to potential harm, lack of treatment for the intended patient, and severe legal and ethical breaches related to patient identification and medication administration. Professional reasoning. Professionals should employ a systematic approach to medication administration. This involves the 5 rights of medication administration: the right patient, the right drug, the right dose, the right route, and the right time. Any deviation from these principles, or any ambiguity in the prescription, should trigger a pause and a request for clarification from the prescribing veterinarian. Maintaining accurate and complete medical records, including all prescriptions and administrations, is a fundamental professional and regulatory requirement. Question 3. Market research demonstrates that veterinary technicians are increasingly involved in interpreting and communicating diagnostic imaging results. A veterinarian performs an abdominal ultrasound on a canine patient and identifies a focal area within the liver that appears darker than the surrounding tissue. The veterinarian asks the veterinary technician for their initial observation of this specific finding. Which of the following terms would best represent the technician's accurate and professional communication of this ultrasound finding? Option A, looks like a shadow. Option B, opaque. Option C, hypoechoic. Option D, dark spot. The correct answer is C, hypoechoic. Explanation: scenario analysis. This scenario presents a common challenge in veterinary practice, where a veterinarian relies on a veterinary technician to accurately interpret and communicate diagnostic findings. The challenge lies in ensuring the technician possesses the precise terminology to convey the significance of a diagnostic procedure's outcome to the veterinarian, thereby facilitating appropriate treatment decisions. Miscommunication due to imprecise terminology can lead to delayed or incorrect treatment, impacting patient welfare, and potentially leading to regulatory scrutiny regarding the standard of care. Correct approach analysis. The correct approach involves the veterinary technician accurately identifying and articulating the diagnostic procedure's outcome using precise medical terminology. This aligns with the core responsibilities of a certified veterinary technician, CVT, as defined by regulatory bodies, which include assisting in diagnostic procedures and understanding their implications. Using terms like hypoechoic to describe a lesion on an ultrasound is specific and informative, allowing the veterinarian to form a differential diagnosis and plan treatment effectively. This demonstrates adherence to professional standards and ethical obligations to patient care. Incorrect approaches analysis. Using vague or nonspecific descriptions like dark spot fails to convey the objective findings of the diagnostic imaging. This lacks the precision expected of a CVT and hinders the veterinarian's ability to interpret the results accurately, potentially leading to a breach of the standard of care. Ethically, it compromises the veterinarian's ability to provide informed treatment. Employing layman's terms or analogies, such as looks like a shadow, while understandable to a client, is inappropriate when communicating with a veterinarian. This demonstrates a lack of professional competency in diagnostic terminology and can lead to misinterpretation of critical findings. It fails to meet the professional communication standards required within the veterinary team, confusing terminology from different diagnostic modalities, such as describing an ultrasound finding with terms more suited to radiography, e.g., opaque, indicates a fundamental misunderstanding of the diagnostic procedure and its specific descriptive language. This can lead to significant diagnostic errors and is a failure to uphold the professional standards of a CVT. Professional reasoning. Professionals should approach such situations by prioritizing accurate and precise communication. This involves a thorough understanding of the terminology associated with various diagnostic procedures. When presented with diagnostic findings, the decision-making process should involve 1. Identifying the specific diagnostic modality used. 2. Recalling or referencing the appropriate descriptive terms for findings within that modality. 3. Communicating these findings clearly and concisely to the veterinarian. If unsure, seeking clarification from the veterinarian or consulting reliable veterinary resources is paramount to ensuring patient safety and professional integrity. Question 4. Cost-benefit analysis shows that implementing a fully automated, real-time inventory tracking system for all controlled substances, coupled with a simplified, less frequent manual reconciliation process, could significantly reduce administrative overhead. However, this approach would necessitate a reduction in the frequency of physical inventory counts and a less stringent verification of every single dispensed unit against the electronic log. What is the most compliant and professionally responsible approach to managing controlled substances in this scenario? Option A. Dispose of all controlled substances that are nearing expiration through a third-party waste disposal service without detailed individual tracking of each disposed item. Option B. Adopt the simplified manual reconciliation and reduced physical inventory counts to realize the cost savings. Assuming the automated system is highly reliable, option C, implement the automated system but maintain rigorous, frequent manual reconciliation and physical inventory counts as required by regulations, even if it increases administrative time. Option D, delegate the entire controlled substance management process to the veterinary practice manager, who has extensive experience in inventory control, to oversee the automated system and simplified reconciliation. The correct answer is C. Implement the automated system but maintain rigorous, frequent manual reconciliation and physical inventory counts as required by regulations, even if it increases administrative time. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice, balancing the need for efficient inventory management of controlled substances with strict regulatory compliance. The temptation to streamline processes for cost savings can lead to overlooking critical security and record-keeping requirements, potentially resulting in diversion or loss, which carries severe legal and ethical consequences. The professional challenge lies in identifying and implementing procedures that are both cost-effective and fully compliant with controlled substance regulations. Correct approach analysis. The correct approach prioritizes meticulous record-keeping and secure storage as mandated by federal and state controlled substance regulations. This includes maintaining an accurate, up-to-date inventory of all controlled substances received, dispensed, administered, or otherwise disposed of. Secure storage, such as a locked cabinet or safe, is essential to prevent unauthorized access and diversion. Regular audits and reconciliation of the inventory against dispensing records are crucial for identifying discrepancies promptly. This approach ensures accountability, minimizes the risk of diversion, and demonstrates a commitment to regulatory adherence, which is paramount for maintaining a veterinary practice's license and reputation. Incorrect approaches analysis. One incorrect approach involves relying solely on the pharmacy's automated dispensing system without supplementary manual checks. While automated systems can improve efficiency, they are not infallible and may not capture all nuances of controlled substance handling, such as physical inventory verification or specific disposal procedures. This can lead to discrepancies that go unnoticed, violating the requirement for accurate and verifiable records. Another incorrect approach is to delegate the primary responsibility for controlled substance inventory management to junior staff without adequate training or direct supervision by a licensed veterinarian. Controlled substance regulations place ultimate responsibility on the veterinarian. Inadequate training can lead to errors in record-keeping, improper storage, or failure to identify signs of diversion, all of which are regulatory violations. A third incorrect approach is to dispose of expired or unwanted controlled substances without following the specific DEA-approved disposal methods. Simply discarding them in regular waste or flushing them down the drain is a direct violation of federal regulations designed to prevent environmental contamination and diversion. Proper disposal requires specific procedures, often involving a DEA-registered reverse distributor or specific chemical inactivation methods, and meticulous documentation of the disposal process. Professional reasoning. Professionals should approach controlled substance management with a risk-based mindset, understanding that the potential for diversion and the severe penalties for noncompliance necessitate a proactive and diligent approach. The decision-making process should involve 1. Thoroughly understanding all applicable federal D and state veterinary board regulations regarding controlled substances. 2. Implementing a robust, multi-layered system of checks and balances for inventory, dispensing, and disposal. 3. Ensuring all staff involved are adequately trained and understand their roles and responsibilities. 4. Conducting regular internal audits and reconciliations to identify and address any discrepancies immediately. 5. Consulting with regulatory bodies or legal counsel when in doubt about specific procedures. Question 5. Operational review demonstrates a need to enhance the team's understanding and consistent application of anatomical and physiological terminology during patient assessments and case discussions. Which of the following approaches best addresses this need while upholding professional standards? Option A. Relying on the veterinarian to provide all anatomical and physiological explanations during team meetings, assuming technicians will absorb the information passively. Option B. encouraging team members to use descriptive language that is easily understood by the general public, even if it deviates from strict anatomical nomenclature, to improve client communication. Option C. Implementing a mandatory in-service training program that focuses on the precise definitions and correct usage of key anatomical and physiological terms, with an emphasis on their application in diagnosing and treating common and complex veterinary conditions. Option D. Prioritizing the memorization of disease names and their symptoms over the detailed understanding of the affected anatomical structures and physiological processes. Correct answer is C. Implementing a mandatory in-service training program that focuses on the precise definitions and correct usage of key anatomical and physiological terms, with an emphasis on their application in diagnosing and treating common and complex veterinary conditions. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary medicine where accurate communication of anatomical and physiological terms is paramount for patient care and team collaboration. Misinterpreting or misusing these terms can lead to diagnostic errors, incorrect treatment plans, and potential harm to the animal. The professional challenge lies in ensuring all team members, from veterinarians to veterinary technicians, share a common and precise understanding of these fundamental concepts. Correct approach analysis. The correct approach, which involves a comprehensive review and standardized use of anatomical and physiological terminology, represents best professional practice because it directly supports the core principles of veterinary medicine. Adherence to established terminology ensures clarity, reduces ambiguity, and promotes accurate record-keeping, all of which are critical for continuity of care and legal compliance. This aligns with the ethical obligation to provide competent care and the regulatory expectation for accurate medical documentation. Incorrect approaches analysis. An approach that prioritizes colloquial or informal descriptions over precise anatomical terms is professionally unacceptable. This introduces ambiguity and can lead to miscommunication, potentially resulting in incorrect diagnoses or treatments. Ethically, it fails to uphold the standard of care expected in veterinary practice. From a regulatory standpoint, it compromises the accuracy and completeness of patient records, which can have legal ramifications. An approach that focuses solely on common conditions without reinforcing the underlying anatomical and physiological structures is also professionally deficient. While familiarity with diseases is important, a deep understanding of the body systems is essential for diagnosing novel or complex cases. This approach risks superficial knowledge and can hinder effective problem-solving, violating the duty to provide thorough and competent care. An approach that relies on the veterinarian to exclusively define and communicate all anatomical and physiological concepts without empowering the veterinary technician to understand and utilize them is inefficient and limits the technician's role. Veterinary technicians are integral members of the healthcare team and require a robust understanding of these terms to effectively assist in diagnosis, treatment, and client education. This approach fails to leverage the full capabilities of the veterinary team and can impede efficient workflow, indirectly impacting patient care. Professional reasoning. Professionals should approach situations requiring precise terminology by first identifying the established and accepted terms within the veterinary field. This involves consulting reliable anatomical and physiological references and adhering to the terminology used in veterinary literature and professional guidelines. When in doubt, seeking clarification from colleagues or supervisors is crucial. The decision-making process should prioritize clarity, accuracy, and consistency in communication to ensure optimal patient outcomes and maintain professional integrity. Question 6. Consider a scenario where a canine patient presents with rapid, shallow breathing, audible crackles upon auscultation of the lungs, and a reluctance to lie down. The veterinarian suspects a condition affecting the animal's ability to efficiently exchange gases. Which organ system structure and function are most directly implicated by these clinical signs? Option A, digestive system. Option B, musculoskeletal system. Option C, nervous system. Option D, respiratory system. The correct answer is D, respiratory system. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires the certified veterinary technician, CVT, to interpret subtle clinical signs related to a specific organ system's dysfunction. The challenge lies in accurately identifying the affected system and understanding the underlying physiological implications to provide appropriate nursing care and support to the veterinarian. Misinterpretation can lead to delayed or incorrect treatment, impacting patient welfare and potentially violating professional standards of care. Correct approach analysis. The correct approach demonstrates best professional practice by focusing on the observable clinical signs and correlating them with the known functions of the respiratory system. Recognizing tachypnea, increased respiratory effort, and abnormal lung sounds as indicators of compromised gas exchange is fundamental to veterinary nursing. This approach aligns with the CVT's role in patient assessment, monitoring, and communication of findings to the veterinarian, which is a core competency expected under Veterinary Practice Acts and professional guidelines that emphasize accurate observation and reporting. Incorrect approaches analysis. One incorrect approach might involve focusing solely on the animal's behavior without a systematic assessment of physiological parameters. This fails to meet the professional standard of objective data collection and can lead to overlooking critical signs of organ dysfunction. Ethically, it represents a failure to provide diligent care. Another incorrect approach could be to assume a diagnosis based on a single, nonspecific sign, such as lethargy, without further investigation into the underlying organ system. This bypasses the necessary diagnostic process and can result in misdirected care, which is a violation of the duty of care owed to the patient. A third incorrect approach might be to recommend specific treatments or medications without veterinary direction. This constitutes the unauthorized practice of veterinary medicine, a serious regulatory violation that undermines the veterinarian-client-patient relationship and compromises patient safety. Professional reasoning. Professionals should approach such scenarios by employing a systematic assessment process. This involves observing the patient, gathering vital signs, performing a physical examination, and then correlating these findings with their knowledge of organ system, anatomy, and physiology. The next step is to communicate these objective findings clearly and concisely to the veterinarian, allowing for informed diagnostic and therapeutic decisions. This structured approach ensures that patient care is based on evidence and professional expertise, adhering to regulatory requirements for competent practice. Question 7. The investigation demonstrates a situation where a veterinary technician is reviewing a patient's medical record and encounters the abbreviation PRN in the context of medication administration. The technician is unsure of the precise meaning and its implications for the patient's current treatment plan. Which of the following actions best reflects professional and ethical practice in this scenario? Option A. Use a commonly understood veterinary abbreviation dictionary to look up PRN and then administer the medication without further consultation. Option B. Assume PRN means as needed and proceed with administering the medication based on the veterinarian's general instructions for pain management. Option C. Consult a veterinarian or a senior veterinary technician to clarify the meaning of PRN and its specific application to the patient's care before administering any medication. Option D. Administer the medication as scheduled, interpreting PRN as a routine dosage to avoid delaying treatment. The correct answer is C. Consult a veterinarian or a senior veterinary technician to clarify the meaning of PRN and its specific application to the patient's care before administering any medication. Explanation. The investigation demonstrates a scenario where a veterinary technician's understanding and application of common veterinary abbreviations are critical for patient safety and accurate record keeping. This situation is professionally challenging because misinterpreting or misusing abbreviations can lead to significant medical errors, such as incorrect drug dosages, administration routes, or treatment plans. The technician must navigate the ethical imperative to provide competent care and uphold professional standards, which includes clear and precise communication. The correct approach represents best professional practice because it prioritizes patient well-being and adherence to established veterinary protocols. Accurate interpretation and appropriate use of abbreviations ensure that all members of the veterinary team have a consistent understanding of the patient's status and treatment, minimizing the risk of error. This aligns with the core ethical principles of veterinary medicine, emphasizing beneficence and non-maleficence, and the regulatory requirement for meticulous record-keeping. An incorrect approach, such as guessing the meaning of an unfamiliar abbreviation or using a non-standard abbreviation, represents a failure to uphold professional competence and a disregard for patient safety. This could lead to direct harm to the animal, violating the principle of non-maleficence. Furthermore, it undermines the integrity of medical records, which is a regulatory requirement and essential for continuity of care and potential legal or accreditation reviews. Another incorrect approach, like assuming an abbreviation is universally understood without verification, demonstrates a lack of diligence and a failure to adhere to best practices in communication within a professional setting. This can lead to miscommunication and subsequent errors, impacting the quality of care provided. Professional decision-making in such situations requires a systematic approach. First, recognize the importance of accurate interpretation of all medical information. Second, if an abbreviation is unclear, the technician has a professional obligation to seek clarification from a veterinarian or a more experienced colleague before acting on it. Third, when documenting, use only approved and commonly understood abbreviations, or spell out terms if there is any doubt about clarity. This ensures that all records are unambiguous and contribute to effective patient management. Question 8. Upon reviewing a canine patient presenting with lethargy, decreased appetite, and intermittent vomiting, what is the most physiologically sound initial approach to assessing the potential involvement of the gastrointestinal tract, considering the sequential functions of its various segments? Option A. Systematically evaluate the patient's history, physical examination findings, and presenting signs in the context of the entire gastrointestinal tract's anatomy and physiology, from esophagus to anus, considering absorption and motility. Option B. Immediately recommend advanced imaging such as an ultrasound or endoscopy to visualize the entire tract without a thorough initial physical assessment. Option C. Focus solely on the stomach's role in digestion and vomiting, as these are the most prominent signs. Option D. Prioritize investigating potential parasitic infections as a common cause of vomiting and lethargy in dogs, regardless of other findings. The correct answer is C. Focus solely on the stomach's role in digestion and vomiting, as these are the most prominent signs. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a technician must interpret clinical signs related to a complex physiological system. The challenge lies in differentiating between signs that might indicate a primary gastrointestinal issue versus those that could be secondary to other systemic diseases affecting the digestive tract. Accurate assessment requires a strong understanding of the anatomy and physiology of the gastrointestinal tract and how disruptions in one area can manifest elsewhere. The technician's role is critical in gathering accurate information to guide the veterinarian's diagnosis and treatment plan. Correct approach analysis. The correct approach involves a systematic evaluation of the patient's history, physical examination findings, and presenting signs, correlating them with the known anatomy and physiology of the gastrointestinal tract. This includes understanding the normal function of each segment, from ingestion and mechanical breakdown to enzymatic digestion, nutrient absorption, and waste elimination. Recognizing that signs like vomiting, diarrhea, or abdominal pain can originate from various parts of the tract, stomach, small intestine, large intestine, or even be referred pain from other organs, necessitates a comprehensive, top-down and bottom-up assessment. This aligns with best professional practice by ensuring all relevant physiological processes are considered, leading to a more accurate differential diagnosis and appropriate diagnostic and therapeutic interventions. This methodical approach is implicitly supported by general veterinary practice standards that emphasize thorough patient assessment and evidence-based care. Incorrect approaches analysis. One incorrect approach would be to immediately assume a specific diagnosis based on a single prominent sign, such as solely focusing on diarrhea as a sign of large intestinal disease without considering other possibilities. This fails to acknowledge the interconnectedness of the gastrointestinal tract and the potential for upstream issues, e.g., small intestinal malabsorption, to cause secondary changes in the large intestine. This approach risks misdiagnosis and delayed or inappropriate treatment, violating the ethical obligation to provide competent care. Another incorrect approach would be to overlook or downplay less obvious clinical signs, such as subtle changes in appetite or hydration status, in favor of more dramatic symptoms. This neglects the importance of a complete clinical picture. The gastrointestinal tract's physiology dictates that even minor disruptions can have cascading effects, and a thorough assessment requires attention to all physiological indicators. Failing to do so can lead to missing crucial diagnostic clues and is a failure of professional diligence. A third incorrect approach would be to rely solely on anecdotal evidence or past experiences with similar-looking cases without a current, systematic physiological assessment. While experience is valuable, each patient is unique, and the underlying physiological cause of symptoms can vary. This approach bypasses the critical thinking required to apply anatomical and physiological knowledge to the current patient-specific presentation and could lead to a recurrence of past diagnostic errors, which is professionally unacceptable. Professional reasoning. Professionals should employ a structured problem-solving approach. This begins with gathering comprehensive patient data, history, signalment, physical exam. Next, they should formulate a list of differential diagnoses based on the patient's signs and their understanding of gastrointestinal anatomy and physiology. This list should then be prioritized, and diagnostic tests selected to rule in or rule out these differentials. Throughout this process, continuous reevaluation of findings against physiological principles is essential. Question 9. The efficiency study reveals that a veterinary technician has observed a discrepancy between the results of a urinalysis performed earlier in the day and the interpretation documented by the supervising veterinarian in the patient's medical record. The urinalysis results, as recorded by the technician, suggest a potential for a different diagnosis than what the veterinarian has indicated in the treatment plan. The technician is concerned that the current treatment plan may not be optimal for the patient's condition. Option A. The technician should independently adjust the prescribed medication dosage based on their interpretation of the urinalysis results to better align with their perceived diagnosis. Option B. The technician should respectfully approach the veterinarian, present the observed urinalysis results, and politely request clarification on the discrepancy and its impact on the treatment plan. Option C. The technician should proceed with the treatment plan as documented by the veterinarian, assuming the veterinarian has a more comprehensive understanding of the case. Option D. The technician should immediately contact the veterinary board to report the veterinarian's potential misinterpretation of the diagnostic results. The correct answer is D. The technician should immediately contact the veterinary board to report the veterinarian's potential misinterpretation of the diagnostic results. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between a veterinarian's directive and a veterinary technician's ethical and regulatory obligations concerning patient care and the appropriate use of diagnostic information. The technician is privy to information that suggests a potential misinterpretation of diagnostic findings, which could directly impact the patient's treatment plan and well-being. The challenge lies in navigating this situation respectfully while upholding professional standards and ensuring the best outcome for the animal. Correct approach analysis. The correct approach prioritizes patient welfare and adherence to professional practice standards. By seeking clarification from the veterinarian and presenting the observed discrepancy in a non-confrontational manner, the veterinary technician acts ethically and within their scope of practice. This aligns with the fundamental principle of veterinary medicine to provide competent and compassionate care. Regulatory frameworks for veterinary technicians typically emphasize the importance of accurate record-keeping, clear communication with the supervising veterinarian, and the technician's role in recognizing and reporting potential issues that could affect patient health. This approach upholds the technician's duty to the patient and their professional responsibility to contribute to accurate diagnosis and treatment. Incorrect approaches analysis. One incorrect approach involves directly altering the treatment plan without consulting the veterinarian. This is a significant regulatory and ethical failure. Veterinary technicians operate under the supervision of a veterinarian and are not authorized to independently change treatment protocols, especially when it involves interpreting diagnostic results. This action exceeds the technician's scope of practice, potentially jeopardizes patient safety, and violates regulations governing veterinary practice. Another incorrect approach is to ignore the discrepancy and proceed with the treatment as directed. This is ethically problematic as it disregards the technician's professional judgment and the potential for patient harm. It also fails to uphold the technician's responsibility to contribute to accurate patient care. From a regulatory standpoint, this could be viewed as a failure to act with due diligence and to report observations that could impact patient outcomes. A third incorrect approach is to immediately report the veterinarian to a regulatory body without first attempting to resolve the issue directly. While reporting mechanisms exist for serious professional misconduct, this approach bypasses the established chain of communication and problem-solving within a veterinary practice. It can be seen as an overreaction and a failure to engage in professional dialogue, which is often the first and most appropriate step in addressing perceived discrepancies. This could also be considered a breach of professional courtesy and a premature escalation that may not be warranted. Professional reasoning. Professionals should employ a structured decision-making process that begins with patient assessment and understanding the immediate situation. When a discrepancy is noted, the first step is to gather all relevant information and confirm the observation. The next step is to communicate concerns clearly and respectfully to the supervising veterinarian, presenting the observed data and seeking clarification. This communication should be framed as a request for understanding rather than an accusation. If concerns remain unresolved, or if there is a clear and present danger to the patient, then escalation to practice management or, if necessary, the relevant regulatory body would be the subsequent step, following established protocols. Question 10. Examination of the data shows a veterinarian has prescribed a medication for a canine patient experiencing acute lameness and swelling. The technician reviews the prescription and identifies the drug as carprofen. Which of the following represents the most appropriate understanding of this medication's classification and its implications for patient care? Option A. Carprofen is an opioid analgesic primarily used for severe pain, and its administration is straightforward without significant side effects. Option B. Carprofen is a corticosteroid used to suppress the immune system and reduce inflammation, and can be administered without regard to other medications. Option C. Carprofen is an antibiotic used to treat bacterial infections, and its use is indicated for any cause of lameness. Option D. Carprofen is classified as a non-steroidal anti-inflammatory drug, NSAID, used to manage pain and inflammation, requiring careful consideration of renal and gastrointestinal health in the patient. The correct answer is D. Carprofen is classified as a non-steroidal anti-inflammatory drug, NSAID, used to manage pain and inflammation, requiring careful consideration of renal and gastrointestinal health in the patient. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary practice where a technician must interpret and apply drug information to a patient's specific needs. The challenge lies in accurately identifying the drug class, understanding its mechanism of action and potential side effects, and then determining the most appropriate use based on the patient's condition and the veterinarian's orders. Misinterpreting drug classifications or their uses can lead to incorrect administration, adverse drug reactions, or failure to achieve therapeutic goals, all of which have significant implications for patient welfare and professional accountability. Correct approach analysis. The correct approach involves a thorough understanding of the drug's classification, which dictates its pharmacological action and therapeutic indications. For example, recognizing a drug as a non-steroidal anti-inflammatory drug, NSAID, immediately informs the technician about its pain-relieving, fever-reducing, and anti-inflammatory properties, as well as common contraindications, e.g., gastrointestinal issues, renal compromise, and potential side effects. This knowledge allows for safe and effective administration as prescribed, ensuring the patient receives appropriate pain management or treatment for inflammation. This aligns with the core responsibilities of a certified veterinary technician to assist in patient care under veterinary supervision, which includes accurate drug administration and monitoring. Incorrect approaches analysis. One incorrect approach would be to administer the drug based solely on its brand name, without understanding its underlying classification and mechanism. This is a significant regulatory and ethical failure, because it bypasses the critical knowledge base required for safe practice. The brand name alone does not convey information about potential drug interactions, contraindications, or the specific therapeutic class, leading to a high risk of error. Another incorrect approach is to assume the drug is safe for all patients without considering the patient's specific medical history, concurrent medications, or existing conditions. This demonstrates a lack of due diligence and a failure to adhere to the principle of patient-specific care, which is a cornerstone of veterinary medicine and professional conduct. Administering a drug without confirming the veterinarian's specific dosage and route of administration, even if the classification is understood, is also a critical failure, as it deviates from direct veterinary orders and can lead to overdose or underdose. Professional reasoning. Professionals should approach drug administration by first confirming the veterinarian's prescription, then identifying the drug's generic name, and subsequently researching its classification, mechanism of action, indications, contraindications, and common side effects. This systematic approach ensures that the technician has a comprehensive understanding of the drug's properties and how it will affect the specific patient. When faced with uncertainty, the professional decision-making process dictates consulting the veterinarian or reliable veterinary drug references before proceeding with administration. This prioritizes patient safety and adherence to regulatory standards. Question 11. Performance analysis shows a veterinarian is considering prescribing a medication for a condition not listed on its approved label. The animal's owner is seeking treatment for a severe, life-threatening illness for which no approved therapies are readily available. What is the most appropriate course of action for the veterinarian? Option A. Discuss the rationale for off-label use, potential benefits, risks, and alternatives with the owner. Obtain informed consent and meticulously document the decision-making process and consent in the medical record. Option B. Refuse to prescribe the medication due to the lack of specific regulatory approval for this indication, advising the owner to seek a referral to a specialist. Option C. Administer the medication immediately to address the life-threatening condition, assuming the owner's consent is implied due to the severity of the illness. Option D. Prescribe the medication without further discussion, as the severity of the illness justifies immediate intervention, and the owner is likely to agree. The correct answer is A. Discuss the rationale for off-label use, potential benefits, risks, and alternatives with the owner, obtain informed consent, and meticulously document the decision-making process and consent in the medical record. Explanation. Scenario analysis. This scenario presents a common challenge in veterinary pharmacology where a veterinarian prescribes a medication for off-label use. The challenge lies in balancing the potential therapeutic benefit for the animal against the inherent risks and the regulatory framework governing drug use. Ensuring client-informed consent, understanding the legal implications of off-label prescribing, and maintaining accurate medical records are paramount. Correct approach analysis. The correct approach involves a thorough discussion with the client about the rationale for off-label use, potential benefits, risks, and alternatives. This aligns with the ethical obligation to provide informed consent and the regulatory expectation that veterinarians act in the best interest of the animal while adhering to established guidelines. Documenting this discussion and the veterinarian's professional judgment in the medical record is crucial for legal and ethical compliance. This demonstrates a commitment to client communication and responsible drug use, which are core tenets of veterinary practice. Incorrect approach is analysis. Prescribing the medication without a detailed discussion about its off-label status and potential risks fails to obtain proper informed consent from the client. This is an ethical failure and potentially a regulatory violation, as it bypasses the client's right to make an informed decision about their pet's care. It also neglects the veterinarian's responsibility to fully disclose all relevant information. Administering the medication without considering the lack of specific regulatory approval for this indication, and without documenting the rationale and client discussion, creates a significant legal and ethical vulnerability. It suggests a lack of due diligence in adhering to drug usage guidelines and a failure to maintain comprehensive medical records, which are essential for accountability and professional standards. Failing to explore alternative approved treatment options before resorting to off-label use demonstrates a potential lapse in professional judgment. While off-label use can be appropriate, it should generally be a considered decision after approved therapies have been evaluated or deemed unsuitable. This approach prioritizes expediency over a comprehensive and evidence-based treatment plan. Professional reasoning. Professionals should approach off-label prescribing by first consulting available literature and expert opinion to support the proposed use. A comprehensive discussion with the client is essential, covering the intended benefits, known risks, potential side effects, and the absence of approved alternatives. Obtaining explicit consent for off-label use and meticulously documenting the entire process, including the rationale, client discussion, and consent, in the patient's medical record, is critical. This systematic approach ensures ethical practice, regulatory compliance, and optimal patient care. Question 12. The risk matrix shows a moderate likelihood of a specific antibiotic causing gastrointestinal upset in feline patients. A client calls distressed, reporting their cat, who was recently prescribed this antibiotic, is now experiencing vomiting and lethargy. What is the most appropriate immediate action for the certified veterinary technician? Option A. Reassure the client that gastrointestinal upset is a common side effect and likely not serious, advising them to continue the medication as prescribed. Option B. Advise the client to immediately discontinue the antibiotic and monitor the cat closely, then report back to the clinic. Option C. Ask the client detailed questions about the vomiting frequency, appearance, lethargy, and any other symptoms. Then relay this information to the veterinarian for assessment. Option D. Instruct the client to bring the cat to the clinic immediately for examination without first consulting the veterinarian. The correct answer is B. Advise the client to immediately discontinue the antibiotic and monitor the cat closely, then report back to the clinic. Explanation. This scenario is professionally challenging because it requires the certified veterinary technician, CVT, to balance immediate client communication with the need for accurate and complete information regarding a potential adverse drug reaction. CVT must act as a crucial link between the veterinarian, the client, and the animal's well-being, adhering to professional standards and regulatory guidelines. The correct approach represents best professional practice because it prioritizes client education and safety while respecting the veterinarian's ultimate responsibility for diagnosis and treatment. By gathering detailed information from the client and presenting it to the veterinarian, the CVT ensures that the veterinarian has the necessary data to assess the situation accurately. This aligns with the ethical obligation to act in the best interest of the animal and to maintain open and honest communication with the client. Furthermore, it adheres to the regulatory framework that defines the scope of practice for CVTs, which typically involves assisting the veterinarian and providing client education under their supervision. An incorrect approach that involves immediately advising the client to stop the medication without veterinary consultation is a failure to adhere to the scope of practice. This action could lead to inappropriate discontinuation of a necessary medication, potentially harming the animal or delaying appropriate treatment. It bypasses the veterinarian's diagnostic authority and could be construed as practicing veterinary medicine without a license, a serious regulatory and ethical violation. Another incorrect approach, such as dismissing the client's concerns as minor without further investigation, demonstrates a lack of diligence and a failure to uphold the duty of care. This could result in a misdiagnosis of a serious adverse reaction, leading to patient harm and potential legal or disciplinary action against the CVT and the veterinary practice. It also erodes client trust. A third incorrect approach, such as only relaying the client's report to the veterinarian without asking clarifying questions, might lead to incomplete or inaccurate information being presented. This can hinder the veterinarian's ability to make an informed decision and could indirectly contribute to patient harm. Professional practice demands thoroughness and the ability to elicit critical details. The professional decision-making process in such situations should involve 1. Actively listening to and acknowledging the client's concerns. 2. Gathering specific, detailed information about the observed signs, onset, duration, and any other relevant factors. 3. Consulting with the supervising veterinarian promptly, presenting all gathered information clearly and concisely. 4. Following the veterinarian's instructions regarding further client communication or patient management. 5. Documenting all interactions and actions taken. Question 13. Analysis of a canine patient under general anesthesia for a routine dental prophylaxis reveals a sudden decrease in pulse quality, pale mucous membranes, and a prolonged capillary refill time. The technician has been monitoring the patient closely throughout the procedure. Considering the patient's cardiovascular system, what is the most appropriate immediate action for the certified veterinary technician? Option A. Administer a bolus of intravenous fluids without consulting the veterinarian, as this is a common supportive measure. Option B. Focus on adjusting the anesthetic gas to a lighter plane, as this is the most likely cause of the observed signs. Option C. Immediately inform the supervising veterinarian of the specific cardiovascular changes observed and request further assessment. Option D. Continue monitoring other anesthetic parameters, assuming the changes are a temporary effect of the anesthetic agents. The correct answer is C. Immediately inform the supervising veterinarian of the specific cardiovascular changes observed and request further assessment. Explanation. Scenario analysis. This scenario presents a common yet critical challenge in veterinary medicine, recognizing and responding to potential cardiovascular compromise in a patient undergoing a routine procedure. The technician must integrate knowledge of normal cardiovascular anatomy and physiology with the ability to observe subtle clinical signs and understand the implications of those signs in the context of anesthesia. The challenge lies in differentiating between expected physiological changes under anesthesia and signs indicative of a developing emergency, requiring prompt and accurate assessment. Correct approach analysis. The correct approach involves a systematic assessment of the patient's cardiovascular status, focusing on key indicators like heart rate, rhythm, pulse quality, mucous membrane color, and capillary refill time. This approach aligns with best professional practice by prioritizing patient safety and welfare, which are paramount ethical and regulatory obligations for certified veterinary technicians. By recognizing deviations from normal parameters and understanding their potential causes related to the cardiovascular system, the technician can provide timely and accurate information to the veterinarian, enabling appropriate intervention. This proactive monitoring and assessment directly supports the veterinarian's ability to manage the patient effectively and adhere to standards of care. Incorrect approaches analysis. One incorrect approach involves dismissing the observed changes as normal anesthetic effects without further investigation. This failure to thoroughly assess the patient's cardiovascular status constitutes a breach of professional duty and potentially violates regulations that mandate competent patient care and monitoring. It overlooks the technician's responsibility to identify and report any abnormalities that could compromise patient safety. Another incorrect approach is to immediately administer emergency medications without consulting the veterinarian or performing a more comprehensive cardiovascular assessment. This bypasses the veterinarian's role in diagnosis and treatment planning and could lead to inappropriate or unnecessary drug administration, potentially harming the patient. This action disregards the collaborative nature of veterinary practice and the established hierarchy of medical decision-making, which is often implicitly or explicitly supported by regulatory frameworks emphasizing supervision and communication. A further incorrect approach is to focus solely on non-cardiovascular parameters while ignoring the subtle but significant cardiovascular changes. This demonstrates a lack of comprehensive patient assessment and an incomplete understanding of how anesthetic agents and surgical stress can impact the cardiovascular system. Such a narrow focus can lead to delayed recognition of a critical cardiovascular event, jeopardizing patient outcomes and failing to meet the expected standard of care. Professional reasoning. When faced with a patient exhibiting potential cardiovascular compromise during anesthesia, a certified veterinary technician should employ a structured decision-making process. This involves 1. Maintaining a high index of suspicion for cardiovascular issues, especially in patients undergoing anesthesia or surgery. 2. Performing a thorough and systematic cardiovascular assessment, evaluating heart rate, rhythm, pulse quality, blood pressure if monitored, mucous membrane color, and capillary refill time. 3. Correlating observed findings with the patient's anesthetic depth, surgical procedure, and any known pre-existing conditions. 4. Communicating any concerning findings promptly and clearly to the supervising veterinarian, providing specific observations and potential concerns. 5. Following the veterinarian's instructions for further assessment or intervention, while also being prepared to offer informed suggestions based on their technical expertise. This systematic and communicative approach ensures patient safety and upholds the ethical and regulatory responsibilities of the profession. Question 14. Process analysis reveals that a certified veterinary technician is performing an abdominal ultrasound on a canine patient. After acquiring a series of images, the technician is reviewing them. Which of the following actions best demonstrates adherence to best practices in ultrasound image assessment and preparation for veterinary interpretation? Option A. Relying solely on the machine's automatic optimization settings to ensure image clarity and proceeding to present the images without further manual adjustment or critical review. Option B. Acquiring a broad range of images without a focused assessment of their diagnostic quality or a systematic search for abnormalities, assuming the veterinarian will identify any issues. Option C, making a preliminary diagnosis based on the ultrasound findings and communicating this directly to the pet owner before the veterinarian has reviewed the images. Option D, critically evaluating each acquired image for technical quality, e.g., gain, depth, focus, artifacts, and systematically reviewing the visualized anatomy for any deviations from normal or suspicious findings before presenting them to the veterinarian. The correct answer is D, critically evaluating each acquired image for technical quality, e.g., gain, depth, focus, artifacts, and systematically reviewing the visualized anatomy for any deviations from normal or suspicious findings before presenting them to the veterinarian. Explanation: scenario analysis. This scenario presents a common challenge in veterinary diagnostics where a technician must interpret ultrasound images to guide further diagnostic steps. The challenge lies in the technician's responsibility to accurately assess image quality and identify potential abnormalities, which directly impacts the veterinarian's diagnostic decisions and subsequent patient care. Misinterpretation or inadequate image acquisition can lead to delayed diagnosis, unnecessary procedures, or even misdiagnosis, all of which have significant ethical and professional implications. Correct approach analysis. The correct approach involves the technician meticulously evaluating the acquired ultrasound images for technical quality, including proper gain, depth, focus, and the absence of artifacts. This evaluation should be followed by a systematic review of the anatomical structures visualized, comparing them to normal anatomical references and noting any deviations or suspicious findings. This represents best professional practice because it ensures that the veterinarian receives the most accurate and informative diagnostic data possible. Adherence to established protocols for image acquisition and interpretation, as often outlined by professional veterinary technician associations or continuing education resources, is ethically mandated to provide competent care. This proactive assessment by the technician minimizes the risk of overlooking critical findings and supports efficient and effective veterinary decision-making. Incorrect approaches analysis. One incorrect approach is to simply acquire images without critically assessing their quality or systematically reviewing the visualized anatomy for abnormalities. This fails to meet the standard of care expected of a certified veterinary technician. Ethically, it represents a failure to exercise due diligence and professional judgment, potentially leading to incomplete or misleading diagnostic information for the veterinarian. This could be considered a breach of the technician's duty to assist in providing competent medical care. Another incorrect approach is to make definitive diagnoses based solely on ultrasound findings without consulting the veterinarian. While technicians are trained in interpreting diagnostic imaging, the ultimate diagnosis rests with the veterinarian. This approach oversteps the technician's scope of practice, which is a regulatory failure in most jurisdictions. Ethically, it can lead to miscommunication and potentially incorrect treatment plans, jeopardizing patient welfare. A third incorrect approach is to rely solely on automated image optimization features of the ultrasound machine without manual adjustment and critical evaluation. While these features can be helpful, they do not replace the need for a skilled technician to understand the underlying principles of ultrasound physics and how to manipulate settings to achieve optimal diagnostic images for specific anatomical regions and suspected pathologies. This can lead to suboptimal image quality and missed findings, representing a failure in professional competence and potentially a breach of the standard of care. Professional reasoning. Professionals should approach ultrasound interpretation by first prioritizing image quality. This involves understanding the principles of ultrasound physics and how to manipulate machine settings to overcome common artifacts and optimize visualization of target structures. Following image acquisition, a systematic review of the visualized anatomy should be performed, comparing findings to established normal parameters. Any deviations or suspicious findings should be clearly documented and communicated to the veterinarian. This systematic, evidence-based approach, coupled with an understanding of one's scope of practice and a commitment to ongoing learning, forms the foundation of sound professional decision-making in diagnostic imaging. Question 15. The efficiency study reveals that a veterinary practice is experiencing delays in diagnosing complex orthopedic and neurological conditions. A technician is tasked with evaluating the optimal use of CT and MRI for these cases, considering their fundamental principles and common applications in veterinary medicine. Which of the following approaches best reflects an understanding of these modalities and their appropriate clinical application? Option A. Prioritize CT for detailed evaluation of bone integrity, fracture assessment, and detection of mineralized lesions, while recommending MRI for comprehensive soft tissue visualization, including neural structures, ligaments, and tumors. Option B. Utilize CT for all soft tissue evaluations, such as suspected ligament tears and neurological lesions, due to its faster scan times. Option C. Recommend MRI for all bone abnormalities, including fractures and osteosarcomas, as it provides superior detail of bone marrow changes. Option D. Treat CT and MRI as interchangeable modalities, selecting either based on equipment availability without considering their distinct diagnostic strengths. The correct answer is A. Prioritize CT for detailed evaluation of bone integrity, fracture assessment, and detection of mineralized lesions, while recommending MRI for comprehensive soft tissue visualization, including neural structures, ligaments, and tumors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a veterinary technician to interpret and apply knowledge of advanced imaging modalities, CT and MRI, in a practical clinical context, specifically regarding their fundamental principles and appropriate uses in veterinary medicine. The technician must discern the most suitable imaging technique based on the suspected pathology and the inherent strengths of each modality, while also considering patient safety and diagnostic efficacy. This demands more than rote memorization. It requires critical thinking to match the technology to the clinical need. Correct approach analysis. The correct approach demonstrates a thorough understanding of the basic principles of CT and MRI and their respective applications in veterinary diagnostics. It correctly identifies that CT excels in visualizing bone, calcifications, and acute hemorrhage due to its rapid acquisition and sensitivity to density differences. MRI, conversely, is superior for soft tissue contrast, detailed visualization of neural structures, ligaments, and tumors, owing to its sensitivity to water content and magnetic properties. Choosing the modality that best aligns with the suspected pathology ensures the most accurate and efficient diagnostic pathway, adhering to the ethical principle of providing competent care and minimizing unnecessary procedures or costs for the client. This aligns with the professional responsibility to utilize diagnostic tools judiciously and effectively. Correct approaches analysis. An approach that prioritizes CT for all soft tissue evaluations, including suspected neurological lesions or ligament tears, fails to leverage the superior soft tissue contrast resolution of MRI. This would lead to potentially misdiagnosis or incomplete characterization of the pathology, violating the standard of care and potentially causing harm to the patient by delaying appropriate treatment. It also represents a failure to utilize the most appropriate diagnostic tool, which can be seen as inefficient and potentially wasteful of client resources. An approach that exclusively recommends MRI for all bone abnormalities, such as fractures or osteosarcomas, overlooks the high resolution and speed of CT in evaluating bony structures. While MRI can show some bone marrow changes, CT is generally the preferred modality for detailed fracture assessment, surgical planning for orthopedic procedures, and identifying mineralized lesions. Relying solely on MRI for bone pathology would be diagnostically suboptimal and could lead to misinterpretations or delays in diagnosis and treatment. An approach that suggests both CT and MRI are interchangeable for all diagnostic purposes demonstrates a fundamental misunderstanding of their distinct principles and applications. This would lead to unnecessary duplication of imaging, increased costs for the client, and potential patient stress without providing additional diagnostic value. It reflects a lack of critical judgment in selecting the most appropriate and efficient diagnostic tool for a given clinical question. Professional reasoning. Professionals should employ a systematic decision-making process when faced with diagnostic imaging choices. This involves 1. Thoroughly gathering patient history and performing a complete physical examination to formulate a differential diagnosis. 2. Considering the specific anatomical region and suspected pathology. 3. Evaluating the strengths and limitations of available imaging modalities, CT, MRI, radiography, ultrasound, in relation to the differential diagnosis. 4. Selecting the modality that offers the highest likelihood of providing a definitive diagnosis with the least risk and cost to the patient and client. 5. Consulting with the veterinarian to confirm the diagnostic plan. This structured approach ensures that diagnostic decisions are evidence-based, patient-centered, and ethically sound. Question 16. Research into the diagnostic process for a canine patient presenting with lethargy, anorexia, and icterus reveals a presumptive diagnosis of leptospirosis. Which of the following terms most accurately and professionally describes the primary pathological manifestation of this disease in the liver? Option A, hepatic inflammation. Option B, liver sickness. Option C, yellowing of the liver. Option D, jaundice. The correct answer is A, hepatic inflammation. Explanation. Scenario analysis. This scenario presents a professional challenge due to the critical nature of accurate disease terminology in veterinary medicine. Miscommunication or incorrect labeling of a patient's condition can lead to inappropriate treatment, delayed diagnosis, potential harm to the animal, and legal or ethical repercussions for the veterinary team. The certified veterinary technician, CVT, must demonstrate a thorough understanding of specific medical terms to ensure clear and precise communication within the healthcare team and with the client. Correct approach analysis. The correct approach involves utilizing precise and universally accepted veterinary medical terminology to accurately describe the patient's condition. This aligns with professional standards of practice, which mandate clear and unambiguous communication to ensure patient safety and effective care. Adhering to established terminology prevents misinterpretation and supports evidence-based veterinary medicine, a core principle expected of CVTs. Incorrect approaches analysis. One incorrect approach involves using vague or colloquial descriptions. This fails to meet professional standards for medical record-keeping and communication, potentially leading to confusion among veterinary staff and misinformed clients. It bypasses the established system of precise terminology designed to avoid ambiguity and ensure consistent understanding of a diagnosis. Another incorrect approach is to use terms that are technically inaccurate or describe a different condition. This is a direct failure in professional competence and can have severe consequences for patient care, including administering incorrect treatments or overlooking the actual disease process. This directly violates the ethical obligation to provide competent care and uphold the integrity of the veterinary profession. A further incorrect approach is to rely solely on client-provided descriptions without verifying or translating them into accurate medical terminology. While client communication is vital, the CVT's role is to interpret and document the condition using professional language. Failing to do so can perpetuate misunderstandings and hinder proper medical assessment and treatment planning. Professional reasoning. Professionals should approach patient documentation and communication by first identifying the presenting signs and symptoms. They should then consult reliable veterinary medical resources, textbooks, diagnostic guides, peer-reviewed literature, to determine the most accurate and specific diagnostic term for the observed condition. This term should then be used consistently in all medical records, client communications, and discussions with other veterinary professionals. If there is any uncertainty, seeking clarification from a veterinarian is paramount. Question 17. Compliance review shows that a certified veterinary technician applicant's understanding of basic tissue types and their functions is being assessed. Which of the following best demonstrates a comprehensive understanding of the 4 primary tissue types and their roles in veterinary medicine? Option A. The technician correctly identifies epithelial tissue as being found on the skin and in the digestive tract, but struggles to articulate its secretory functions. Option B. The technician accurately describes epithelial tissue as a barrier and lining, connective tissue as providing support and binding, muscle tissue as enabling movement, and nervous tissue as transmitting signals. Option C. The technician explains that connective tissue's main role is to hold organs in place, without mentioning its role in blood or bone formation. Option D. The technician defines muscle tissue solely by its ability to produce voluntary movement, overlooking its involuntary functions in internal organs. The correct answer is B. The technician accurately describes epithelial tissue as a barrier and lining, connective tissue as providing support and binding, muscle tissue as enabling movement, and nervous tissue as transmitting signals. Explanation. Scenario analysis. This scenario presents a challenge in a veterinary practice where a technician is tasked with assisting in a surgical procedure. The challenge lies in ensuring the technician possesses the foundational knowledge of tissue types and their functions, which is critical for understanding surgical site integrity, wound healing, and potential complications. Misunderstanding these basic biological principles can lead to errors in surgical assistance, post-operative care, and communication with the veterinarian, potentially compromising patient safety and violating professional standards of care. Correct approach analysis. The correct approach involves the technician demonstrating a comprehensive understanding of the four primary tissue types: epithelial, connective, muscle, and nervous, and their specific roles within the animal's body. This understanding is essential for a certified veterinary technician, CVT, as it directly informs their ability to assist in surgery, anticipate tissue responses, and provide appropriate post-operative care. For instance, recognizing the regenerative capacity of epithelial tissue is crucial for wound closure. Understanding the supportive and binding functions of connective tissue is vital for suturing and tissue handling. Comprehending the contractile nature of muscle tissue is important for surgical site preparation and awareness of muscle function. And appreciating the role of nervous tissue in sensation and motor control is key for pain management and monitoring neurological status. This knowledge base is a fundamental requirement for competent veterinary practice and is implicitly or explicitly covered in CVT certification standards and educational curricula, ensuring patient safety and adherence to the veterinarian's instructions. Incorrect approaches analysis. One incorrect approach involves the technician only being able to identify epithelial tissue by its location on the skin. This demonstrates a superficial understanding, failing to grasp its diverse functions, lining organs, secretion, absorption, and its presence beyond the external surface. This limited knowledge could lead to misjudging the significance of internal epithelial linings during surgery or in diagnosing internal conditions. Another incorrect approach is focusing solely on the structural support provided by connective tissue, neglecting its other vital roles such as energy storage, adipose tissue, transport blood, and defense, immune cells within connective tissue. A CVT needs to understand the full spectrum of connective tissue functions to effectively assist in procedures involving these diverse tissues. A third incorrect approach is describing muscle tissue only in terms of voluntary movement, ignoring the critical functions of involuntary muscle in organs like the heart and digestive system. This oversight could lead to a lack of awareness regarding the impact of surgical manipulation or anesthetic agents on these vital involuntary functions. Professional reasoning. When faced with a question about tissue types and functions in a veterinary context, a CVT should engage in a systematic recall and application of their foundational biological knowledge. This involves considering each tissue type individually, recalling its defining characteristics, and then articulating its specific functions within the animal body, particularly as they relate to veterinary medicine and surgical procedures. The decision-making process should prioritize accuracy, completeness, and relevance to patient care. If any aspect of the knowledge is unclear, the professional should consult reliable veterinary resources or seek clarification from a supervising veterinarian. This ensures that all actions taken are based on sound scientific principles and contribute to the best possible patient outcomes, aligning with the ethical and professional responsibilities of a CVT. Question 18. Strategic planning requires a certified veterinary technician to interpret a canine patient's clinical chemistry panel, which reveals an elevated alkaline phosphatase ALP and a mildly increased alanine aminotransferase ALT, alongside a normal gamma-glutamyltransferase GGT. The patient is a 10-year-old Labrador retriever presenting with lethargy and polydipsia. Which of the following interpretations best guides the next diagnostic steps? Option A. The elevated ALP and ALT are solely attributable to the patient's age, and no further diagnostic workup is necessary. Option B. The elevated ALP and ALT are definitively indicative of primary liver disease, and the normal GGT is an anomaly that should be disregarded. Option C. The combination of elevated ALP and ALT, despite a normal GGT, in an older dog with these clinical signs, strongly suggests a potential endocrine disorder such as Cushing's disease or a hepatic issue requiring further investigation. Option D. The normal GGT indicates that the elevated ALP and ALT are not clinically significant, and the patient's symptoms are likely unrelated to liver function. The correct answer is C. The combination of elevated ALP and ALT, despite a normal GGT, in an older dog with these clinical signs strongly suggests a potential endocrine disorder such as Cushing's disease or a hepatic issue requiring further investigation. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the Certified Veterinary Technician, CVT, to interpret complex clinical chemistry results in the context of a patient's presenting signs and history. Misinterpretation can lead to incorrect diagnostic conclusions, delayed or inappropriate treatment, and ultimately, compromised patient welfare. The CVT must not only understand what each test indicates, but also how multiple results interact and correlate with the clinical picture, demanding a high level of diagnostic reasoning and critical thinking within their scope of practice. Correct approach analysis. The correct approach involves a systematic evaluation of all available clinical chemistry parameters in conjunction with the patient's signalment, history, and physical examination findings. This holistic approach ensures that the interpretation is clinically relevant and leads to appropriate diagnostic and therapeutic recommendations. For example, elevated alkaline phosphatase, ALP, in a young, growing animal might be physiological, whereas in an older, lethargic dog with other signs of illness, it could indicate hepatic disease, Cushing's disease, or bone pathology. A CVT's role is to identify these patterns and communicate them clearly to the veterinarian, supporting informed decision-making. This aligns with the ethical obligation to provide competent care and act in the best interest of the animal, as outlined by Veterinary Practice Acts and professional guidelines that define the CVT's responsibilities in diagnostic support. Incorrect approaches analysis. One incorrect approach is to focus solely on a single abnormal laboratory value without considering the broader clinical context. For instance, identifying an elevated blood urea nitrogen BUN and immediately concluding renal failure without assessing hydration status, other renal parameters, creatinine, electrolytes, and clinical signs would be a significant diagnostic error. This approach fails to meet the standard of care and could lead to misdiagnosis and inappropriate treatment, violating the ethical duty to provide accurate and thorough diagnostic support. Another incorrect approach is to rely on generalized interpretations found in textbooks or online resources without tailoring them to the specific patient. While these resources are valuable, they do not account for individual patient variability, concurrent conditions, or the nuances of a particular clinical presentation. This can lead to oversimplification or misapplication of information, potentially delaying or misdirecting the diagnostic process. This demonstrates a failure to exercise independent professional judgment and a lack of critical analysis, which are essential components of competent veterinary care. A third incorrect approach is to communicate laboratory findings to the owner directly without veterinary oversight or interpretation. While CVTs are skilled in client communication, the interpretation of complex clinical chemistry results and the subsequent diagnostic and therapeutic plan fall under the veterinarian's purview. Providing definitive interpretations or treatment advice without veterinary consultation could exceed the CVT's scope of practice, potentially leading to client confusion, inappropriate self-treatment, and a breakdown in the veterinarian-client-patient relationship, which is often governed by specific veterinary practice acts. Professional reasoning. Professionals should employ a structured decision-making framework. This begins with a thorough review of the patient's signalment, history, and physical examination findings. Next, all available diagnostic data, including clinical chemistry results, should be systematically evaluated. The CVT should then correlate these findings with the clinical picture, identifying any discrepancies or patterns that require further investigation. Finally, the CVT should communicate their findings and interpretations clearly and concisely to the supervising veterinarian, offering insights that facilitate accurate diagnosis and effective treatment planning. This process emphasizes critical thinking, collaboration, and adherence to professional standards and ethical obligations. Question 19. Which approach would be most appropriate for a certified veterinary technician to take when presented with a patient requiring elective surgery, considering the need for thorough preoperative care and effective communication with both the veterinarian and the owner? Option A. Rely solely on the veterinarian's initial instructions for the procedure, performing only the tasks explicitly assigned without independent patient assessment. Option B. Proceed with the procedure as quickly as possible to accommodate the owner's stated desire to minimize costs, performing only the most basic preoperative checks. Option C. Delegate all preoperative assessment and preparation tasks to veterinary assistants, focusing only on monitoring the patient during the procedure itself. Option D. Conduct a comprehensive physical examination. Review the patient's medical history, identify potential anesthetic and surgical risks, and communicate these findings to the veterinarian to collaboratively develop a preoperative plan. The correct answer is D. Conduct a comprehensive physical examination, review the patient's medical history, identify potential anesthetic and surgical risks, and communicate these findings to the veterinarian to collaboratively develop a preoperative plan. Explanation. Scenario analysis. This scenario is professionally challenging because it requires balancing the immediate needs of the patient with the owner's financial constraints and understanding of the veterinary process. The technician must accurately assess the patient's condition, identify potential risks associated with the planned procedure, and communicate these findings effectively to the veterinarian and the owner, all while adhering to professional standards and ethical obligations. The owner's emotional state and financial limitations add layers of complexity to the decision-making process. Correct approach analysis. The correct approach prioritizes a thorough preoperative assessment and preparation, aligning with the core principles of veterinary patient care and the responsibilities outlined in Veterinary Technician Practice Acts. This involves a comprehensive physical examination, review of the patient's history, and identification of any pre-existing conditions that could increase anesthetic or surgical risk. This meticulous preparation ensures that the veterinarian has all necessary information to make informed decisions regarding anesthetic protocols, surgical planning, and potential complications. It also allows for proactive management of any identified risks, thereby safeguarding patient welfare and adhering to the standard of care expected of a certified veterinary technician. This approach directly supports the ethical duty to provide competent care and to act in the best interest of the animal. Incorrect approach is analysis. One incorrect approach would be to proceed with minimal assessment, relying solely on the veterinarian's initial instructions without independent patient evaluation. This fails to uphold the technician's responsibility for comprehensive patient assessment, potentially overlooking critical factors that could impact patient safety. It represents a failure to exercise professional judgment and could lead to adverse outcomes, violating the duty of care. Another incorrect approach would be to defer all preoperative decisions and preparations solely to the veterinarian, even when the technician possesses the knowledge and skills to contribute significantly. This underutilizes the technician's expertise and can create inefficiencies in patient care. Ethically, may also be seen as a failure to actively participate in ensuring optimal patient outcomes. A third incorrect approach would be to prioritize the owner's immediate financial concerns over the patient's medical needs during the preoperative assessment. While client communication and financial considerations are important, they should not compromise the thoroughness of the medical assessment or the implementation of necessary preparatory steps that ensure patient safety. This approach could lead to inadequate preparation and increased risk to the patient, which is a violation of professional duty. Professional reasoning. Professionals should adopt a systematic approach to preoperative care. This begins with a thorough patient assessment, including a physical examination and review of the patient's history. Next, identify any potential risks or complications based on the patient's condition and the planned procedure. Communicate these findings clearly and concisely to the veterinarian. Collaborate with the veterinarian to develop a tailored preoperative plan, including any necessary diagnostics, fluid therapy, or medications. Finally, ensure all necessary equipment and supplies are prepared and that the patient is physically and mentally prepared for the procedure, always prioritizing patient welfare and safety within the scope of practice and ethical guidelines. Question 20. The review process indicates a need to reevaluate the understanding of the primary anatomical location responsible for the critical exchange of respiratory gases within a canine patient presenting with dyspnea. Which of the following structures is the principal site for this vital gas exchange? Option A, pharynx. Option B, alveoli. Option C, trachea. Option D, diaphragm. The correct answer is B, alveoli. Explanation. The review process indicates a need to assess the certified veterinary technician's understanding of the anatomical structures of the respiratory tract and their role in gas exchange, specifically in the context of a clinical implementation challenge. This scenario is professionally challenging because it requires the technician to apply theoretical knowledge of respiratory anatomy to a practical situation involving a patient's compromised respiratory function. Accurate identification and understanding of the specific anatomical locations where gas exchange occurs are critical for effective patient assessment, communication with the veterinarian, and implementation of appropriate treatment plans. The correct approach represents best professional practice because it demonstrates a thorough understanding of the physiological processes of respiration and the specific anatomical sites involved. By correctly identifying the alveoli as the primary site of gas exchange, the technician is able to accurately interpret clinical signs, understand the implications of respiratory distress, and contribute effectively to patient care. This aligns with the ethical and professional responsibility of a certified veterinary technician to possess and apply comprehensive knowledge of animal physiology and anatomy to ensure optimal patient outcomes. Adherence to these principles is implicitly required by the standards of practice for veterinary technicians, which emphasize accurate assessment and informed intervention. An incorrect approach that focuses on the trachea or bronchi as the primary sites of gas exchange represents a significant failure in understanding fundamental respiratory physiology. The trachea and bronchi are primarily conducting airways, responsible for transporting air to and from the lungs. While they are crucial components of the respiratory system, they are not the sites where oxygen enters the bloodstream and carbon dioxide is removed. This misunderstanding could lead to misinterpretation of diagnostic findings, inappropriate treatment recommendations, and ultimately, compromised patient care. Ethically, this demonstrates a lack of competence in a core area of veterinary technology, potentially violating the duty of care owed to the animal patient. Another incorrect approach that emphasizes the diaphragm as the primary site of gas exchange demonstrates a confusion between the mechanics of breathing and the process of gas exchange itself. The diaphragm is a muscle essential for ventilation, the movement of air into and out of the lungs, but it does not directly participate in the diffusion of gases across a membrane. This fundamental error in understanding the respiratory system's function would lead to flawed clinical reasoning and an inability to accurately assess or manage respiratory conditions. Professionally, this indicates a deficiency in essential knowledge required for safe and effective practice as a certified veterinary technician. A further incorrect approach that suggests the pharynx is the primary site of gas exchange highlights a misunderstanding of the entire respiratory pathway. The pharynx is part of the upper respiratory tract and serves as a passageway for air and food. It plays no role in the diffusion of gases between the air and the blood. This level of anatomical and physiological inaccuracy would render a technician incapable of performing basic respiratory assessments or understanding the implications of respiratory disease. This represents a serious professional and ethical failing, as it directly impacts the ability to provide competent care and uphold the standards of the veterinary profession. The professional decision-making process for similar situations should involve a systematic approach. First, accurately recalling and applying foundational knowledge of anatomy and physiology. Second, correlating this knowledge with observed clinical signs and diagnostic information. Third, communicating findings and potential implications clearly and concisely to the veterinarian. And fourth, implementing treatment plans under veterinary supervision with a clear understanding of the underlying physiological mechanisms. When faced with uncertainty, a technician should always err on the side of seeking clarification or additional information, rather than proceeding with potentially flawed assumptions.